So, my journal review is about physical therapy assessment and management of infants with congenital muscular torticollis. So, just some overview and background. CMT is a result of a shortening or excessive contraction of the SCM muscle, which limits the range of motion in both lateral flexion and rotation of the neck. And it also causes an imbalance of muscle function around the entire neck, not just the one affected side. And also, due to a positional preference, there's a high risk that the infant could develop a deformational plagiocephaly, which literally means oblique head. So it refers to an asymmetrical shape of the head from prolonged pressure to the same side, same area of the head. And here are some just regular pictures of what CMT presents as. And the top picture is one of the ones that we've seen quite a few times in class. And the bottom left one is a good example of how the baby's head is tilted toward the affected muscle and the chin is pointed away from the affected muscle. So investigating PT interventions, so the PT's goal is to prevent or reduce that plagiocephaly and achieve symmetrical head position, range of motion, and function of the neck. In 2013, a study was conducted in New Zealand to investigate the current physical therapy management and issues in treating infants with congenital muscular torticollis. And 89 physical therapists that work frequently with CMT patients were invited to participate in a survey to get a better understanding about how it's treated. So some basic information of what this survey was. 40 therapists actually chose to participate. Mostly were from Sweden and Denmark. And it was just an anonymous questionnaire with 28 questions divided into 5 sections, all collecting information about specific treatment methods for CMT. After a survey, after the survey was taken, a panel of experts then developed a draft of a possible assessment protocol for treatment of CMT. And all of these experts have been working with CMT patients for over 20 years. So over half of the participants that utilized passive stretching, regardless of the infant's age. The stretch was performed by rotating toward the affected muscle and movement of lateral flexion away from the affected muscle. The stretch was held for a median of about 20 seconds for 3 repetitions, and that was depending on how compliant the infant was to getting their neck stretched. So like I just said, infant compliance is not always easy because most infants generally don't like to have some stranger, especially not their parent, handling them and causing them any kind of pain or discomfort or keeping them in a position where they aren't able to move. So most infants can get really fussy with that. And some passive stretching was adjusted, like I said, according to the compliance of the infant. And also measurements were pretty difficult in this survey because they don't like to be positioned for the proper measurement. And like I had said earlier, they don't like to be held still if they don't want to be held still. Parental compliance is also a huge determining factor of how the child is going to do with treatment, because it has to be brought home in order for them to get the optimal treatment. So 83% of the therapists that participated in this study gave informational handouts to the parents regarding proper home exercise program. And proper handling is crucial toward the treatment and effectiveness of CMT, so the parents need to know how to do that properly without just hurting them or not doing any good at all. So the results that I found, that the most common measurement tool was a large goniometer for measurement of lateral flexion of the neck. And many therapists had very similar answers when it came to methods of interventions that were used. And so the perceived most effective forms of the intervention were passive stretching, which I had talked about earlier, handling advice, which, like I just had mentioned, is very important when they're infants, facilitation of neck muscle strengthening exercises, because since that one SCM is super, super tight, the other one needs to be strengthened also to try to reposition that head to a proper straight length. And facilitation of active cervical range of motion is also important so that child can know how to move their neck properly. And just a little opinion about this survey. So I thought it was a really informative survey when it came to getting a common ground for treatments for CMT. I do believe that more research should be done about treatment options and effectiveness so that it would be beneficial to get the best possible evidence-based practice. So I feel like if they delve into a little more, they could get a lot more information out of it, and it would be really awesome to hear about. So thanks for listening, and hope you liked it. And here's my references.